Hey everyone, and welcome. If you're an expecting parent, you know that pregnancy is just this incredible mix of excitement and, let's be honest, a ton of questions. So today, we're going to talk about a really powerful tool that can offer some early clarity and a bit of peace of mind: non-invasive prenatal testing, or NIPT for short.
I mean, this is the big question, right? It's the one thing that's on every expecting parent's mind. You want to know everything you possibly can as early as you can, but the number one priority is always keeping your baby safe. So is it even possible to get that information without taking on any risk? Well, believe it or not, modern science has an answer. And that answer is yes.
And this quote, man, it just hits the nail on the head, doesn't it? It perfectly sums up what NIPT is all about. It's about giving you knowledge, empowering you with information, but without all the anxiety that usually comes with waiting and wondering. So, how on earth does science pull this off?
You know, for the longest time, if you wanted definitive genetic information, it meant invasive procedures that carried their own small risks. But that's just not the world we live in anymore. Today, we can get incredibly accurate answers from a simple blood test, giving parents these powerful insights without posing any harm to the baby.
Okay, so let's break it down. What exactly is this test? How does it actually work? The science here it's just incredible, really. So during pregnancy, tiny little fragments of your baby's DNA, their genetic blueprint, naturally make their way into your bloodstream. It's amazing. And NIPT technology is sophisticated enough to find, isolate, and then analyze these tiny fragments to screen for specific genetic conditions. And it does all of this from just one single blood sample taken from your arm.
So, what's this test actually looking for? Well, its main job is to screen for the most common chromosomal conditions, things you've probably heard of, like Down syndrome, which is trisomy 21, Edwards syndrome, and Patel syndrome. And as an option, you can also find out the baby's gender. Plus, you can even choose to screen for much rarer conditions called microdeletions, which are caused by tiny missing pieces of a chromosome.
Okay, this next part is super important to get your head around. NIPT is a screening test, which is totally different from a diagnostic test. So what does that mean? It means it doesn't give you a hard yes or no answer. Instead, it tells you the risk. Is there a low chance or a high chance of a particular condition? Think of it as an incredibly accurate first step, a starting point for information, but it's not the final diagnosis.
All right, so let's talk timing. When do you actually do this test, and who is it really for?
And this is one of the coolest things about NIPT, the timing. You can have this test done as early as 10 weeks into your pregnancy. That offers answers and potential reassurance so much sooner than a lot of the more traditional screening methods.
Now, really, any expecting parent can choose to have an NIPT for peace of mind, but it's often recommended for a few specific reasons. For instance, if you're over 35, or maybe you have a family history of certain genetic conditions. It's also an option if a previous screening test showed something a little unusual. And of course, it's a fantastic option for anyone who just wants that more accurate risk assessment without needing an invasive procedure. And yeah, it's safe and effective for both single and twin pregnancies, including those that came about through IVF.
So what does this actually look like in practice? If you decide NIPT is right for you, you'll find the whole journey is designed to be as simple and as supportive as it can possibly be.
The process itself is really straightforward. It all starts with some pre-test counseling just to make sure you know exactly what the test can tell you, and just as importantly, what it can't. Then it's a simple blood draw. That's it. No fasting, no special prep. That sample gets sent off to a specialized lab, and usually within about a week, the results are ready. The final step is reviewing those results with a professional who will help you understand exactly what they mean.
And now for the part that everyone's really thinking about, getting the results. Let's talk about what happens, especially if the news isn't what you are hoping for.
This is the big one, isn't it? It's the question that can keep you up at night. And it is completely 100% natural to worry about what a high-risk result could mean for you and your family. The most important thing to remember here is that high risk doesn't mean definite. It is not a diagnosis. It's a signal that it's time to have a conversation about what comes next. Usually, that means discussing your options for diagnostic testing, like a CVS or an amniocentesis, which can give you that definitive yes or no answer. But the key is you'll be guided through this whole process with so much sensitivity and support. There's never any pressure, just information and care.
So, as we start to bring this all together, what's the one thing you should really take away from all this? If you remember just one thing, let it be this. NIPT really combines the absolute best of modern science, which is those highly accurate answers, with a gentle, non-invasive approach that always puts the health and well-being of both mom and baby first. And really, that's what this is all about. It's a safe, powerful tool that gives you clarity early on in your pregnancy journey. It's about empowering you with the information you need to make the decisions that feel right for you and your growing family. So, I want to leave you with this final thought. With technologies like NIPT, we have access to information way earlier than any generation before us. And it's really worth thinking about. How is this early knowledge changing the whole experience of pregnancy? It's offering not just data, but maybe a whole new sense of connection and preparation for the amazing journey ahead.